Hi everyone, thanks for listening to my presentations. Today I will be talking about COVID-19, but this will be my fourth edition. You can check my channel for the previous 3 public presentations on COVID-19. I'll be limiting myself to preventive measures only today. Although I should be interested in remdesivir that is gaining ground right now as the drug of choice in treating COVID-19 that is already being supported by the United States, although not yet supported globally, because many countries are still working on many medications when it comes to COVID-19. But I will not delve into that today. I'll be limiting myself to preventive measures only. Okay, let's go. The main measures are hand washing, social distancing, face covering, quarantine, isolation of all identified cases, protection of healthcare workers, family members, and the public. This will form the core of the entire presentation. With that in mind, let's continue. Prevention is going to involve covering the nose when you sneeze or cough, cover the mouth, protect the eyes. PPE. You've heard about that before? Yeah, you're familiar with that, yes. That is personal protective equipment. We need that in CPR, emergency room, intensive care unit, or for anyone taking sample. That is, not only nurses and doctors will need PPE, and anyone handling the corpse of either known COVID-19 patient who has died or unknown. Because in the era of COVID-19, some people would have been diagnosed with something else and actually die of COVID-19 or not, but probably could have acquired COVID-19 one way or the other. So my advice is you get protective equipment when handling the corpse. Interacting or treating any patient with COVID-19 should warrant wearing PPE. And of course, isolation of suspected cases. If we are faced with limited PPE, that may lead to cancellation of non-urgent procedures. And the available PPE should be reserved for only aerosol generating procedures. Don't worry, in a bit I'll go into details of that. We have to reduce contact with the affected patient or patients and the secretions. Can we reuse PPE? Yes, if in a dire situation and we don't have enough, you can reuse a PPE, but take this, but it should be clean or decontaminated. And how can you clean or decontaminate PPE? You can use ultraviolet light, hydrogen peroxide vapor, moist heat, or ethylene oxide. Okay, somebody has put on the PPE. How can you remove it appropriately? The first thing to do is remove and dispose the gloves. Clean your hands with soap and water or alcohol-based sanitizer, then remove the face cover. And immediately also perform hand washing, and you continue after that. Quarantine. You have to quarantine anyone who had contact with affected person or anyone who has traveled and is returning from region or regions with COVID-19. And such individual must call on phone and have phone screening before contacting anyone, either hospitalization presentation or for any transaction whatsoever. Social distancing. This is difficult, eh? Sitting or standing at 2 to 3 meters apart is called social distancing. Anything lower than that is not social distancing. So no overcrowding at restaurants or at the park or at the beach. No. Any gathering more than 2 to 5 people and far apart is not social distancing. Don't visit families in the hospital or long care homes. Don't visit them. Talk to them on phone, FaceTiming. It's pretty hard, right? But that's the way out. Government dedicated centers. In some parts of the world, some countries have created government dedicated centers, and that will handle the diagnosis and treatment of COVID-19 only. Or in some other parts of the world, some sections of the hospital have been designated for COVID-19. All these measures are appropriate. It could be for treatment only or for screening and treatment if positive. And that is pretty good. Screening. Screen all patients visiting healthcare facilities, either long-term, hospital, or clinic. Screen all healthcare workers. Some hospitals have devised a means of screening their members of staff even before entering the building. Screen all long-term care staff. Might be tedious, but it's needful. And screen anyone showing signs and symptoms. And of course, screening could also depend upon government policy, because availability of screening agents can determine the rationalization of such. In other words, even if I give all the lists here, screen every human being, but if the agent to screen is not available, of course there will be rationalization. So the government policy will also play a role here. Mask. All patients should wear masks. All allowed visitors to healthcare facilities should wear masks. Anyone leaving home should wear masks. Anyone going out for any reason like shopping or working should be wearing a mask. All diagnosed patients interacting with anyone, including healthcare workers, should be wearing a mask. Simply put, everyone should be wearing a mask once you are outside your home. It could be cloth face mask, that is fine for all other purposes, but leave N95 for the healthcare workers. So N95 for the healthcare workers, and for all other human beings just walking around the street or for shopping, cloth face mask is good enough. So, still on mask, N95 or greater mask respirator for sample collection. Let there be eye protection with goggles or face shield, and your gloves and gown for sample collection, please. But you can use medical masks and let others use N95 for aerosol generating procedures if the availability is not there in your jurisdiction. Isolation. This might be uncomfortable, but it's needful. Single room with a closed door for COVID-19 diagnosed patient, please. And you can have high efficiency particulate air unit, and that can be placed in the room if airborne infection isolation room is not available. In other words, Airborne infection isolation room is better if it is available, but if you can't get that, you can have high efficiency particulate air unit, and that could be placed in the room where anyone diagnosed with COVID-19 will be treated. Cohorting is helpful. That is a unit for only COVID-19 patients. So about 2 or 3 people or more in one room, but they are all diagnosed with COVID-19. Airborne infection isolation room is better for all aerosol generating procedures. Avoid aerosol generating procedures if possible. Okay, for example, bronchoscopy. You can avoid it if it's not so urgent, but if it is urgent, well, wear your PPE and go ahead. Colonoscopy, swallowing evaluation, and others like CPR, manual ventilation, or tracheostomy. That's why I said if possible, because some are just not possible. You can't just fold your arms and close your eyes. Okay, you can use metered dose inhaler instead of nebulizer. Okay, an airborne infection isolation room is better for all aerosol generating procedures, including your PPE. Okay, some have a negative pressure canopy for continuous positive airway pressure, high flow nasal cannula, and non-invasive ventilation. Nasopharyngeal or oropharyngeal specimen collection doesn't require an isolation room. Home isolation. Home isolation will be appropriate if conditions are pretty mild, but there must be wearing of masks when interacting with anyone. It could be cloth face masks, that's fine, and there should be a separate bathroom and bedroom. And we should not entertain a loss of caregivers. Few caregivers will be enough and appropriate, preferably those without risk factors. And if it is a place rich and endowed with electricity and devices, air conditioning will be better. Surface distancing to 2 to 3 meters with anyone. Still at home, right? Yes, that is home isolation. Turn on your AC. Still on home isolation, the fact that the case is mine and the treatment will be taking place at home doesn't mean we are free to do anything. Hand washing should continue, besides wearing the face mask and limiting contact with people. PPE should be on the caregivers, and then they remove accordingly. So, firstly, remove and dispose the gloves. Clean the hands with soap and water or alcohol-based sanitizer. Then remove the face cover and also perform hand washing. Still on home isolation, family members should not share dishes, holiday utensils, towels, thermometer, beddings, etc. with affected person. Disinfection of all touch places should be done daily. For example, the tables, the doorknobs, and so on. When are we going to discontinue precautions? Well, that will be left to experts and the government agents. So self-isolate until you are tested negative. Healthcare workers that are sick and treated can only return to work based on the guideline in their jurisdiction. So in other words, discontinue precautions is not what we're just going to wake up to say at any time. It's going to be based on the rules and regulations in our jurisdiction. And of course, you have to at least be tested again. If you've tested positive before, you have to be tested again and be confirmed to be negative. Long-term care facilities. Yes, this is a big issue, right? So limit visitors. Test all elderly with any form of contact with a sick COVID-19 patient. Symptoms at long-term care facilities will likely be atypical, and let there be symptom screening for all visitors, okay, and all precautions for all respiratory tract infections. So, in long-term care facilities, when you are faced with some of these symptoms that I'm about to talk about, please isolate and test the individual for COVID-19, please, because the presentation will be atypical, right? So when you're in a long-term care facility and someone is having dizziness, maybe a new onset dizziness, not before, diarrhea, delirium, confusion, malaise, please test for COVID-19, because don't wait till you peak fever and so on. No, it's going to be atypical. Still on long-term care facilities, create a separate unit for the care of the sick residents. And that unit should be away from the healthy residents. Dedicate a certain team of staff to work at the unit created above. Isolate healthy previous roommates under quarantine for 14 days to be sure he or she has not been infected. High efficiency particulate air unit is going to be okay in a private room, okay? And dialysis centers should take all the necessary precautions as well. And community, we need community help, right? Okay, so the whole world should form a community right now, having hygiene with water and soap or alcohol-based sanitizer, hand washing again and again. Cover your cough, please. No congregation. Social distancing must continue. No handshaking. No. Isolate yourself if you have traveled to a region with diagnosed cases or you've been in contact with anyone sick with COVID-19. Help yourself, help the family, help the whole world. Isolate yourself. Face masks if you are going out for anything. Can be cloth, that is fine, okay? Then report anyone with traveling history but not complying with quarantine or isolation. Report to the police in your region. In conclusion, prevention is the key for all of us. It might be difficult, but it is doable. And with that, I've come to the end of the 4th edition of COVID-19, which is all about preventive measures. Prevention is cheaper and it is doable. Thanks for listening. Kindly remember to share and subscribe. Wishing everyone globally well, no cure to those who are sick, and through prevention to those who have not contracted the virus. Thank you.